of the Sustainable Sanitation Alliance. And it's a wonderful day in the sense that a new discussion paper is ready and is sort of, we are launching it here with, and Daphne will put the link into the chat, and we'll have sort of the discussions around this key step. It underlines the importance to think WASH and health together, that WASH is prevention is the best medicine, and that can be done with WASH. We had a lot of wonderful people giving inputs into the paper. Some of them are speaking. Thanks to all of them. SuSanA is living sort of from the enthusiasm and voluntary contribution from its many members, and so that publication is one example of this. If we look into the agenda, then we can see, if you go to the next slide, Daphne, perhaps, a short welcoming from my side, and then I will very spontaneously take over the role of Carolina Probst as she fell sick. So I'll improvise a bit, but maybe then it's shorter, but I can give her warmest regards. She would have loved to be with us, and to underline that that the ministry, who is as well supporting the Sustainable Sanitation Alliance in its base funding, sees this as a very important step and activity. Then Daphne and Natalie will walk us through the paper, and we'll have 3 inputs of 5 minutes each. One will be from Kartik, Columbia University, from Alexia and Lloyd Matamalmania from WaterAid, and from Angelika Broman from the EU DG. And that will give spotlights on what is in the discussion paper. And we'll have a background on why is WASH for Health so important from Sophie Boisson from WHO. We'll have questions, discussions, hopefully many. Put your questions and thoughts into the chat and let us then discuss a bit, and we'll have closing remarks from Gina from Xavier University, who is as well in the Global Steering Committee of SuSanA. So that's the agenda, and just sort of let me give a few points from the perspective of the ministry. Let me again as well welcome each and one of you to today's event on behalf of the German Federal Ministry of BMZ and its division Pandemic Prevention, One Health, which together with our division, it's the one where the SuSanA Secretariat is sort of supported from, is welcoming you, and that already symbolizes bringing together WASH and health. It's the occasion of the World Toilet Day, which is coming day after tomorrow, and which again we can use to symbolize that dignity and health during that day is important. We have still 3.6 billion people living without safe toilets, more than 400 million people still practicing open defecation. 1,000 children under 5 every single day die because of diseases spread due to these circumstances. It's an ongoing global crisis, and we'll only solve it together, and health and WASH has to come together, and that's what's underlined in this paper. Yeah, so maybe just, you know, all the facts. I guess half of the healthcare facilities worldwide don't have water and soap for hand washing, so then they're health dangerous and not healthcare facilities maybe. And so we have to as well find ways how to have a change on that. This is one of the many dimensions we have here. So I can still sort of underline from Christina Probst that she's thanking all the contributors, thanking the Sustainable Sanitation Alliance to bring this together, and is looking forward for the insights and takeaways from this event. And well, thanks to all the speakers and those contributing to the paper. I think that's what I can say on behalf of Carolina Probst. And with this, I think I'm handing over to Daphne and Natalie. Thank you, everybody.
Yes, Thank you very much, Anne, and also hello everyone from my side. I'm Daphne Manolakos. I'm a junior advisor at GIZ, and I have been also a part of the SuSanA Secretariat since 2021 now. And today, my colleague Natalie Schmitz, who is also on the call today, we are both very excited to provide you with an overview of our published discussion paper on WASH for Health. And but before delving into all the details and having some spotlights on the 3 pillars of WASH for Health, I'd like to take a step back to understand more the journey that led us to this point, and also the intrinsic connection between WASH and health within SuSanA. So as you know, the Sustainable Sanitation Alliance over the years played a very important role in bridging the gap between sectors, between the WASH and health initiatives, because our collaborative efforts aim to bring about more sustainable impacts in both sectors, WASH and health. And actually in 2020, at the onset of the COVID-19 pandemic, SuSanA launched its first discussion paper on WASH and health. And within this paper, it did not only highlight the existing opportunities and also the activities within the SuSanA community, it also underscored the synergies between the SuSanA working groups, the 13 working groups that we have, and also the critical health and WASH sector issues. And one notable aspect is, for example, that SuSanA already has the structures needed to collectively and collaboratively create a significant impact, because across all our 13 working groups, we have direct but also indirect connections that all contribute to fundamental services, processes, and also approaches that are crucial for achieving sustainable WASH and health outcomes. And yeah, building on the discussion since 2020, we at SuSanA, we have very ambitious goals. We aim to initiate discussions across these segments of SuSanA, and we try to break down initial barriers between WASH and health sectors, and with such discussion papers and webinars, we try to foster more dialogue between the sectors. And yeah, and also with our knowledge hub at SuSanA, we try to collect and display tools and also interventions from our SuSanA partners and members in our online library, but also we try to foster more discussions around the topic in the forum. And most recently, or actually today, we also launched our blog feature that also serves as a new space, as a new feature to offer our global network of members and partners to share their insights and also their ideas, hopefully also more on WASH for Health in a blog article to the public. So with this, we hope that we inspire the SuSanA community to actively contribute to various components of WASH and health issues. Yes, so given these SuSanA's commitments and features, it was also time for us to update the discussion paper from 2020. And with this new edition, we really tried to focus more on defining the WASH for Health approach, and also to emphasize the importance for successful cooperation between the WASH and health sector. And yeah, Natalie will go more into detail, but we really wanted to have this entry point for dialogue and collaboration with, but also for implementing organizations within these 2 sectors. But now I'd like to hand over to Natalie for a more political background, and for you to understand a bit more the approach towards WASH for Health from our perspective. So Natalie, over to you.
Thanks, Daphne. Yeah, exactly. We also wanted to highlight a bit that this paper, of course, plays into like a bigger political background and also international background. And is not, of course, that now just like this year people thought, oh, wow, WASH and health, that fits so well together. What a brand new idea. I mean, of course, there has been long-standing examples of already good collaborations happening. WHO, many other organizations have been, of course, working on this intersection for a long time. But I mean, as we could also see, especially during COVID-19, just because something is known does not automatically, of course, mean that it's always being done. And as we all know and are aware that working together intersectorally does take quite a lot of effort from everybody, and also, as I like to call it, quite a lot of grit to keep that going. It often falls out of the logic of like how programs and projects are normally planned and how they are funded. And there are, for example, different funding streams, of course, for the different sectors. And this we also know from experience, sharing can be quite hard between the sectors. So this is a bit the underlying background, of course, for this paper. But there are many, many discussions happening also at an international processes and discussions around this topic. To name just a few examples, of course, just this year, the UN Water Conference in March with the interactive dialogue, Water for Health between UNICEF and WHO, and many other sessions, which are, yeah, I probably could not do right to count them all. When the concept paper that was also developed then between WHO and UNICEF to what I just said called Water for Health, access to WASH, including the human rights of safe drinking water and sanitation, which gives like a very nice overview of the linkages to all the other SDGs, not just, of course, SDG 6 and SDG 3 that we've kind of put a spotlight on in this paper. And of course, as you all know, we are in the post-COVID era and also in the, yeah, let's call it the pre-pandemic era, so the next pandemic. Hopefully not just around the corner, with, of course, discussions and activities related to pandemic preparedness and response, pandemic treaties, pandemic funds, where we also kind of wanted to, with this paper, to emphasize, that we have to make sure that the topics of sanitation, hygiene, and WASH do not get forgotten in these discussions, and that we always put the finger on the spotlight there to emphasize that. And as you all know, for GIZ, of course, the shining beacon or the direction is, of course, always also the BMZ, so the German Ministry for Economic Development and Cooperation, where the WASH for Health approach, or this idea of intersectoral collaboration between WASH and health, is also well represented in the new core area strategy that was released this year on health and social protection and demographics. And it stresses in many areas this important interface between the two sectors. And one which is very prominent is, of course, also the necessity of WASH for health system strengthening, especially in the context of healthcare facilities. And this will also be expounded in the spotlights later. So more for that. Okay, so before we go to the spotlights highlighting like the different topics, what is the overall paper or approach about? So as you can see here in this graphic, we wanted to have it a bit more nicely visualized in a graphic. It aims to emphasize a bit the areas between the WASH and health sector where the collaboration between them is, let's say, most needed, but also like in a logical sense, like it's most logical that there's a lot of close collaboration happening there, which also creates for both sectors, of course, the most benefits. And as we said before, this focuses especially on the two SDGs. Of course, there are many other, as you can see down here, linkages to other SDGs and topics, of course. And to show a bit the three main areas which we've identified for this approach, where we see, as I said, the most collaboration already happening and where it makes the most sense. This is, of course, I think this won't be anything new to you in the call. Area 1 is, of course, infectious disease control, where we also get a spotlight in just a moment on one of the topics there. Then we have health system strengthening, as I said, especially related to healthcare facilities, but also resilient institutions overall. And then also the area of sexual and reproductive rights. So putting also a bit of focus on gender here with menstrual health and hygiene, of course, is an important topic, and also mother and newborn health and so on. These three areas are the main pillars, and of course, they're not the topics are not exhaustive. So there are, of course, many other linkages which we couldn't expound on in quite that. Otherwise, it would have been a very long paper. So yes, this is the overall what we wanted to show you, and now I won't take any more away from having the spotlights, so we can get a bit of an idea on examples of practices already happening where there's collaboration going on. And for the first spotlight, I want to hand over to Kartik Chandran. He is from the Columbia University in New York, and he's been working many years on the topic of wastewater monitoring, so using wastewater for public health data, and especially, for example, for COVID monitoring in wastewater, but also other instances. Which fits nicely in this pillar of infectious disease control. And Kartik, here I would hand over to you. Thank you.
Okay, thank you. Thank you, Natalie. Thank you, everyone. Let me share my screen. Can you all see the PowerPoint slide?
Yes.
Yes.
Yeah.
Okay. Okay. Thank you. Since we have 5 minutes and I cannot control the time, I'll just speak very, very fast. Okay. So my name is Kartik Chandran. I'm in the Department of Earth and Environmental Engineering at Columbia. I'm a professor in the School of Engineering. And my work primarily relates to the biological aspects of wastewater treatment and sanitation. And as Natalie mentioned, we have been doing quite a bit of surveillance. This is all we've ever done, actually, even before COVID. Our objectives for surveillance were quite different before COVID, and now, of course, they have shifted, expanded, and so on and so forth. Obviously, the direction of wastewater surveillance is not new. This is showing the pandemic of the cholera pandemic in London in 1854, which was ultimately pinned. So these are the different spots where the water pumps were, and ultimately took the efforts of Dr. John Snow, who was able to pinpoint the spread of cholera, or the origin of cholera in that case, to a contaminated water supply source. So that link between water quality and human health has been recognized for quite some time. And here the link was not just consuming just any garden variety contaminant. It was essentially drinking water contaminated with fecal matter, which was then ingested again, which then resulted in that fecal material being shed out again, and then being dispersed. So if we go try and understand, I just want to ask you something. If I run this on slideshow, can you still see this slideshow? Yes. Yeah. And if I go to the next slide, all of this is happening okay?
All is happening.
Or maybe not. So I'll just keep it like this then.
No, it worked fine. Thank you.
Sorry?
It worked well.
It was better before.
Okay, fine. All right. So when we start with human feces, this is what we have to deal with. We are dealing with primarily water, and then the brown stuff here is all the organics, very little inorganics, but the brown stuff is where most of the carbon resides, and all the biological material is primarily derived from this brown stuff. The water is just water. There might be some exchange between the two phases. What can we do with this? I mean, it's really this aspect that we are trying to open up in terms of answering many different questions. I am actually borrowing from a slide that I took before COVID, years before COVID, and these are the types of answers that we were trying to ask and answer. So we still do this, obviously. The questions are, who is there? What can they do? And the what can they do is facilitated by opening up these microbial networks inside human waste. And this allows us not just to track what we know, but also discover what might not be known. So the unknown unknowns is also something that we are interested in. And then functional activity. What are they actually doing? What is present in our waste that can actually contribute to human health insults? And then, you know, I'm almost amused at some of the statements I myself made, because all of this is happening right now. And this is really, wastewater-based surveillance is really the only direction that has actually worked during the COVID pandemic in terms of controlling the spread and monitoring even. So the premise here is that the fecal sludge microbiome is inherently, or the fecal microbiome is inherently linked to the health of the source, our health. And then, of course, we are using this to infer and predict and enhance and protect human health. We don't have to, like I said, we don't have to go after the known targets. It's easy for us to do SARS-CoV-2 now because we know what we are looking for. But then there are also other invisible threats, so to speak. I don't want to sound alarmist, but directions like antimicrobial resistance, this is something that can be tracked very well using human waste. I'll skip this. We have done this for typhoid and other diseases in the past. This is quite well known. This is just a reflection of some of what we are doing now, also captured, thank you very much, in the paper by Natalie and colleagues and Daphne. So we have been conducting sampling at universities, wastewater treatment plants, prisons, hospitals, and some of this work is actually still ongoing. We are able to predict cases, and even more so now because clinical testing is almost not done as much as it used to be, and reporting is even worse. So again, coming back, wastewater surveillance allows us to get community health at that scale and even in a predictive fashion. This is a recent paper that is going to come out next month. And here we are looking at what makes different SARS-CoV-2 viruses, what gives them their identity. So we are going deeper. It is the what is inside the genomes. What does this mean in terms of, let's say, effectiveness of a vaccine, infectivity, and so on and so forth. And I put the link here if you're interested in taking a look, or please write to me if you're interested. This is an older study that we are doing in India. We are covering quite some geography again in terms of monitoring fecal sludge, septage, and sewage, and trying to infer human health status. And finally, I'll leave you with this. This is some kind of synthesis that we put together. We try to make networks. Here you see different pathogens. Here you see different antimicrobial resistance markers. And then we also look at how these resistance markers are transferred through vertical gene transfer or horizontal gene transfer through different other genetic elements. So this is really opening everything up. This is the network that gives us what we are dealing with, or what we could be dealing with. Yeah, beyond human health, tracking wastewater can also give us ideas into better engineering and other aspects. This is probably not the time to present all of this, but I'll stop here. Thank you again for the platform to share some of this work. Look forward to the other presentations. Thank you.
Thank you so much, Kartik. Wow, very interesting. And yeah, please put the link to the publication and also your contact information. Of course, you can put that in the chat. And also just as a reminder, if there are any questions, we will have a round of questions in the end, but you can also, of course, already put them in the chat so we can collect them. So any direct questions to Kartik, because I can't explain everything he's just mentioned. So, so put them in the chat. And yeah, thanks again, Kartik. And then I would hand over for the next spotlight, which will be by Alexia Knappmann and Lloyd Matalimania from WaterAid, so WaterAid Germany and WaterAid Malawi, who are putting a spotlight on the topic of health system strengthening. And yeah, I think I already teased that to the topic of healthcare facilities. Alexia, Lloyd, the floor is yours. Thanks.
Thank you so much, Natalie, and thank you, SuSanA, for inviting us. Well, we will deep dive into the health systems and for more so in healthcare facilities. And we're looking a little bit at the broader skins, and then my colleague Lloyd thankfully joined me today. We are coincidentally in Tanzania today together, so he spontaneously joined us to explain the project that he's doing in Malawi. Health systems, well, are known to be resilient if they can provide quality healthcare before and after and also during a crisis. But the reality of things is that most systems are completely overburdened and cannot be resilient for further shocks and health crises. And I think the quote that Dr. Tedros said during the World Health Summit in 2022 puts it quite nicely when he said, by and large, the world health systems do not deliver healthcare, they deliver sick care. Many countries spend huge sums treating diseases that could be prevented for a fraction of the cost. And as the discussion paper outlines compellingly, and WASH plays a significant role in infection prevention and control in public health. As a matter of fact, poor water, sanitation, and hygiene services are responsible for around 10% of the global disease burden. And if we look at institutions, functioning and safe WASH services are a prerequisite for IPC there as well, and of course also for quality and dignified healthcare. So what happens if WASH services aren't there? They are underperforming, the safety of patients and health workers are at risks. And Dr. Tedros again said that he compared working in a healthcare facility without WASH as akin to sending nurses and doctors to work without PPE. And I think this is still kind of paraphrasing it on a meta level, but if you look at the quote from Christina, the nurse in Mozambique, it becomes a little bit more clear when she describes her work and she's delivering babies and taking care of sick children and mothers. When she said, we do not have water, the source of water is not near. It is very difficult for us. A health center cannot operate without water. We need water to clean the premises, wash bed sheets and materials. Patients also need to drink water whilst in the healthcare center. And of course, it is absolutely essential for nurses and doctors to be able to wash their hands. Yes, and the situation is not rare. As a matter of fact, the reality is that the world faces devastating health risks due to the major global gaps in WASH services and healthcare facilities. Globally, only 51% of healthcare facilities have basic hygiene services, and close to 4 billion people are reliant on facilities that do not. In the so-called LDCs, only 1 in 3 facilities have basic hygiene services, and only every second one will have basic water services. Well, what this leads to, of course, is increases in spreads of infections, a greater need for and also prolonged use of antibiotics, inflated costs to patients and the health systems, and of course, the emergence and spread of antimicrobial resistant pathogens, all impacting on health outcomes. And it means, of course, millions of preventable deaths. In low and middle income countries, more people die due to the low service quality in healthcare facilities than from lack of access to care. So what can we do about this? I'm very glad that Lloyd is here to explain what they're doing in Malawi. And I would now hand over to you, Lloyd, so you can tell us what you do and how you strengthen health systems through WASH in Malawi. Thank you.
Okay, thank you, Alexia. You can go to the next slide, please. Yeah, so just a bit of introduction. WaterAid in Malawi embarked on a journey in terms of a challenge that we gave ourselves, but also which then we are taking to government and other players, which is called the 150 Healthcare Facilities Challenge. At the time of embarking on this challenge, the data that was there was showing that 150 healthcare facilities did not have adequate WASH services. So that's why we named it the 150 Healthcare Facilities Challenge. And the challenge to WaterAid is that we, together with our partners, intervene in 75 and influence other players, including government, to also do something in the remaining 75. So we've been intervening. To date, we've intervened in over 50 healthcare facilities, with the support from GIZ, from the Scottish Government, from Scottish Water, but also from FCDO, formerly DFID. And in terms of our system strengthening approach, we looked at 3 of the building blocks. So, I mean, we could pan out to more, but mainly it's looking at the enabling environment, or what we would call the strategic planning, but also financing, and then the service delivery aspects. So in Malawi, then, WaterAid has been working to model inclusive and sustainable WASH in healthcare facilities for scale-up by the Ministry of Health. So looking at what we are terming a minimum package, so ensuring that there is a water supply that is reticulated into premises, because most of the health centers, what we call health centers, which is like the third level. If we start with referral hospitals, district hospitals, then we go to health centers, rely on boreholes, groundwater fitted with hand pumps. But we are saying that's not the standard that should be there. We should have reticulated water supply into the facilities, especially the maternity units. So looking at water supply, looking at bath shelters or bathrooms, looking at toilets, placenta pits, incinerators, and as well as ash pits, looking at both water supply, sanitation, hygiene, waste management, and the entire WASH package. So here we are zeroing in on Chikweo Health Center, which is just one of the health centers that we have intervened. Like I said, we have intervened and are currently working cumulatively in 58 over 50 healthcare facilities. So at Chikweo Health Center, this kind of approach led to a collaborative effort involving the community, the facility itself, Chikweo Health Center, but also other government entities at the district and the national levels. So we identified key issues, or what I would call blockages, which included an outdated health center, healthcare facility level infection prevention and control improvement plan or improvement plans. The outdating there happening in the context that at national level, WaterAid and other players supported the government to update the infection prevention and control guidelines. Now they've been renamed infection prevention and control and WASH guidelines, because the realization was that WASH was not coming out strongly in terms of the role WASH plays, water sanitation and hygiene plays in terms of enhancing infection prevention and control. So when the guidelines at national level were updated, it called for also updating of the guidelines at the facility level to align. But also we recognize the low capacity for operational maintenance in terms of funds, skills, as well as the planning for sustained operation of the water supply facilities mainly. This is because in terms of our budget setup, when we look at resources coming from government through the national budget, the health centers don't hold a budget. So the resources just flow to central hospitals and then to the district level. And then if health centers have needs, they have to submit a list of their needs to the district level for the district level to respond, which usually more often than not doesn't happen, or they just get a little bit of what they need. But also we recognize the issue of water supply infrastructure vandalism and theft, where in places where the water supply is solar powered, there would be theft or vandalism of the solar panels and the
Lloyd,
submersible pumps.
Can you hear me?
Yes.
Can you hear me, Lloyd? You have 1 minute.
Yes.
Okay,
thank you
so much for your concrete example. But if you can close it.
Yeah, let me just conclude. So
next 1 minute.
Thank you very much. So let me just conclude. So at the community level, we identified income generating activities. These were identified by the community to support the operation and maintenance of WASH at the healthcare facility. And then there were trainings in terms of the healthcare workers on infection prevention and control, waste management, hand hygiene, and the rest. But also operation and maintenance committees were established and trained to troubleshoot, conduct minor maintenance, and manage resource mobilization. Then at the district level, we supported the district level authorities to do a life cycle cost analysis exercise to help government officials plan for sustainable WASH services. So this is the case study from Malawi, from Chikweo Health Center. Thank you very much.
Thank you so much, Lloyd. And I think it's wonderful that instead of 3 times 5 minutes, now we have 4 times 5 minutes, but we have a concrete example from WaterAid spontaneously brought to the floor. With this, I would like Daphne to invite Angelika.
Yes, and thank you again, Alexia, Lloyd, for giving the insights and the example from Malawi. Now we would like to get to spotlight number 3 on sexual and reproductive health and rights. And I'd like to introduce Angelika Broman, who is a policy officer at the European Commission and also part of the INTPA thematic unit in charge of gender equality, human rights, and democratic governance. So over to you, Angelika.
Thank you. And I'm really pleased to be here with you today. And I have been in Malawi before, so I really enjoyed getting the insights from you. And I can't speak as quickly as professor, but I will speak as quickly as I can. I think we're among, as we say, already convinced people, but talking about menstruation has always been a taboo. It is something I think is important to highlight. Here at the European Commission, we work, of course, in health as well as WASH, but health is also one of Global Gateway's 5 priorities, which is quite important for us because it's a big step forward to assess more funding goes holistically to achieve the SDGs. It is, of course, a priority for us. If you go to the next slide, I will go very quickly through the slides. And at the end, there are some resources that can be shared after the meeting if people need to have. I think this has been mentioned before as well, why we're doing work around linking health and WASH. I think all the SDGs are interconnected. I prefer and often talk about SDG 17, which is about partnership. How can we work coherently together to achieve the results we need for women and girls, boys and men in the countries all over the place, basically. So I was asked to talk about the part of the paper that is presented today, which highlights menstruation. And I think I will focus on that. Even if many of you on the call might have talked about it, I think it's important, if you go to the next slide, to remember that menstruation continues to be surrounded by harmful gender stereotypes, by stigma, by taboos, and that the UN estimates that over 500 million people do not have access to adequate, safe, and affordable menstrual products. So over 500 million people once a month have to drip blood without having any kind of resources or sustainable such. If we go to the next slide, I think it's quite self-explanatory, and I just took India as an example. There are, of course, these issues all around the world, that the most products we use are pads or tampons instead of the more sustainable, environmental friendly ones. But when we come to the wash sector and investing in toilets and sanitation, we often forget where can young girls or women dispose of these products and where can they clean themselves in private. Often there are no, as you know, toilets or places for girls in schools. But the biggest problem is they can't afford the products even, so they drop out of school. It's estimated that 40% of girls in Africa miss school at least 1 week a month due to menstruation. If we go to the next slide, then I'm doing this as quickly as I can. I wanted to also introduce, because a lot of people still don't know that we have sustainable menstrual products such as the cups and the period panties that should be included, I believe, in most intervention, whether they're health or wash or other such interventions, because it comes from everything to who can work in the wash sector. Is there products available for people drilling holes, water holes, for people putting down sanitation pipes? Are there work-friendly places for including women in the wash sector? 2, are the facilities actually available so that it's safe? We also see an increase of gender-based violence around water holes, pumps, and toilets in many communities. I know nowadays this is more taken into planning when you set up facilities, but it's still a very big risk for women going to toilets around the world, that is where they will be raped, and that is something we have to prevent as much as possible. It's also some of the taboos about talking about these products, not least where are they produced, how can they be distributed, how can people have access to them. And I can talk another hour about it, so let's go to the next slide, which is really towards the final 5 minutes here, which I think are topics that are really important and which is highlighted in the paper that you are now launching, which is we need to break the taboos together to be able to talk about menstruation, talk about different kind of, in some countries where I've been working, blood is also a little bit of a taboo, and it's seen that if someone else can access your blood, there can be witchcraft or evil eyes or different kind of shame and blame around it. So disposing of menstrual products can also be a difficult issue. So you need to know the local context, need to know, like I know the great work GIZ have done in Nepal around harmful traditions when it comes to menstruation, and using social media, using different types of techniques to bring this to the forefront. Today I was speaking from representatives from different countries in the Balkans, and they had managed to get this topic onto the Ministry of Finance agenda to ensure that VAT was taken away from menstrual health products. So menstruation is actually an important policy issue, from taxation for empowering women and ensuring better affordability, because it's costly to buy products. And therefore, it's also good to promote the menstrual cups and the menstrual panties that are less costly, environmental safe, sustainable, and less waste management, of course. I think that is my 5 minutes coming to an end. The last slide is just a lot of different papers that you can access on the net, where we as the EU actually promote, of course, gender equality with the action plan that has, we call it Gender Action Plan 3, and it's turning 3 years next week. So there will be a lot of events around the Gender Action Plan. We have the Global Gateway that is investing much more around health, sustainable health and WASH, and of course the Youth Action Plan. I am also here for any questions. Thank you.
Thank you so much, Angelica. That was really a great introduction into MH from the EU level, which is wonderful. So after our topic inputs, we're as well really happy that in producing the paper, discussing it, and among SuSanA partners, WHO always was on board and was helping us to bring it to a good quality. And it's wonderful that we have Sophie with us, which will share with us the broader sort of perspective of WHO ongoing backgrounds, activities, other streams, and I think that's wonderful if we can have that discussion here as well. Sophie, the floor is yours. You have 10 minutes.
Thank you very much. So just before a quick technical check, can you see the presentation okay with the notes
wonderful.
Or without notes?
We can hear you and we can see the presentation.
Okay, perfect. Okay, thank you very much. Well, first of all, thank you very much for inviting WHO to be part of this webinar. It's really great that the health angle on WASH is being given even more attention. So it's great to be here today. So this presentation is really to give a quick overview of some of the key challenges related to WASH and health, and just again highlighting the importance of WASH as a key primary prevention measure. So I always like, can you see it with the notes or without the notes? Sorry.
We can see it perfect without the notes.
Oh, okay.
The notes you have to read.
Okay. That's fine. So just quickly, I like starting the presentation with the WHO definition of health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And here, many of this was highlighted earlier in the presentation. We know that inadequate WASH is linked to many health impacts, whether it's infectious disease and risks, whether it's non-communicable diseases, from long-term exposures to chemicals in drinking water, whether it's natural sources or from anthropogenic sources. But the impact of unsafe WASH really goes well beyond disease. It covers all aspects of social and mental well-being. But when it comes to quantifying the burden associated with unsafe WASH, we're really limited by the available epidemiological evidence. And so, so this slide shows the latest estimates that we have on the burden of disease attributable to unsafe wash. And that's for the year 2019. We see here, and that's just for 4 health outcomes, because for many we don't have sufficient evidence. As you can see here, globally, unsafe wash is responsible for 1.4 million deaths and 74 million dialysis a year. So still a huge burden associated with unsafe wash. And that's just those 4 health outcomes: diarrheal disease, acute respiratory infection, so transmitted helminthiasis, and undernutrition. As you can see, so these estimates were released back in June and through a WHO report, but also this headline made it to the title of the Lancet. So so still crazy that we have such big numbers linked to WASH even today. Of course, diarrhea accounts largely for this overall WASH-related disease burden. If we look at children under 5, we clearly see that diarrheal disease deaths in this age group have declined over the years, but still diarrhea remains among the top 2 infectious causes of the deaths in this category. Also, as we all know, cholera remains a significant public health challenge. And, you know, and after decades of progress against cholera, we see an upsurge in cholera cases since 2021. We see cases are rising. We see that cases are present in countries that have not seen the disease before or in many years. And we also see high case fatality rates. And of course, all that climate change and conflict are making things even worse. And you know what we see in terms of seeing multiple and simultaneous outbreaks is really challenging our ability and the ability of health systems to respond. Another large contributor to the WASH burden is acute respiratory infection. We estimate that 14% of all acute respiratory infections are linked to unsafe hand hygiene practices. Of course, hand hygiene received a huge attention during the COVID-19 pandemic, and it was a key component of national COVID prevention strategies, and yet 1 in 3 people globally do not have water and soap at home. And as it was highlighted in the previous presentation, half of healthcare facilities lack places to wash their hands at points of care or toilets. And that's why WHO and UNICEF launched a hand hygiene for all campaign to address this important gap. Closely linked to unsafe hand hygiene, and again, these numbers were presented in the previous presentation, so I won't go into detail, but I just wanted to highlight that that women are especially affected, and it's hard to imagine giving birth in a facility that does not have running water, and it's not only about infection prevention and control, that was mentioned earlier, but of course, patient dignity is essential. And what you see here on the screen is the results from a survey of over 1 million women and girls of reproductive age in 114 countries. And it was found that after respectful care, WASH was the second most important demand for quality reproductive and maternal health care. So again, just reiterating the critical role that WASH has in healthcare facilities. Of course, in the first presentation that we heard today, antimicrobial resistance, of course, that happens when microbes change over time and no longer respond to medicines. It really makes common infections really hard to treat and has a huge cost for health systems and economies. We know that improved WASH can prevent the emergence and the spread of resistant organisms in many ways, for first preventing infections, both in healthcare facilities and in the community, but also preventing the release of fecal pollutant and antimicrobial compounds in wastewaters that are from healthcare facilities from drug manufacturing plants and from farms. And we know that many countries have prepared national action plans on AMR. We also know that very few include WASH as part of it, unfortunately. Of course, the WASH-related disease burden is largely driven by low and middle income countries. But I think it's important to note that these estimates often hide important subnational disparities. And the burden in high-income countries also is not fully captured. We know that there's big disparities in access within high-income countries, especially among poorer, marginalized communities, and where when we know there are high risks of disease and also outbreaks. But we know both in low and middle income countries and high income countries that small scale water supplies are especially vulnerable to failures and contamination compared to larger systems, and are commonly associated with waterborne disease outbreaks. And in addition to that, of course, you know, climate change, those consequences of climate change like drought and floods and related impact on infrastructure, water availability and quality. Related to climate change, we know that vector-borne diseases are on the rise. You can see a picture of this map. We know that one or more vector-borne disease threaten more than 80% of the world population. Just as an example is dengue, where we've seen the incidence of dengue increasing exponentially over the past decades. And we estimate that half of the world's population is now thought to be at risk. Another example of disease, of vector-borne disease, is the spread of invasive mosquitoes like Anopheles stephensi to Africa, which really challenges existing malaria control efforts. So that's a vector that was mostly present in Asia and the Arabian Peninsula, but for the past couple of years, there's been many cases reported in Africa. And that poses challenge because it's very invasive, but also a very efficient malaria vectors. And the very challenging aspect of that is it's unlike other types of mosquitoes, it really thrives, transmitting malaria, it really thrives in urban settings. So clearly with the increase in urbanizations on the African continent, we can see why this is posing a great challenge. And these mosquitoes really breed in open surface water surface pools, contained in containers, as well as wastewater. So we could see the potential challenges. So as I said, of course, WASH has big impacts on the health systems and economies. The economic benefits of investing in water and sanitation are huge. It's estimated that adequate WASH could lead to a gain of 1.5% of global gross domestic product and almost 5 return on every dollar invested in water and sanitation services. And unfortunately, we see that in many countries, only a small fraction of health spending goes to primary prevention. So really well-targeted WASH sector spending can really have big health benefits. So it was mentioned earlier, we know that the SDGs are ambitious goals, but we also see examples from many countries that progress are possible, especially with government leadership on WASH. And also recognizing that working across multiple sectors is really essential. And I just wanted, and maybe that seems obvious, but I just wanted to, again, reiterate the critical role that the health sector has for example, whether it's on supporting risk-based planning and regulation, whether it's ensuring healthcare facilities have and sustain adequate WASH, or whether it's sharing disease surveillance to better inform where WASH investments and planning need to be made. With that, I will stop, and I'd like to thank you everyone for your attention, and I'm here for any question. Thanks.
Thank you so much, Sophie. I think that was wonderful, sort of to have sort of the WHO perspective, endorsement, broader picture as well against the SuSanA discussion paper. We're 3 minutes to go only. I'm happy there's discussion on bikes in Malawi, and thanks, Lloyd, to your concrete example, which really sparks interest. If there's a quick question, then ask a short question now. Otherwise, go on with bicycle discussions in the chat and others. I will not ask Angelica that the SuSanA partners, we always try to tell them, do your projects, form groups among SuSanA partners. And I would be curious, maybe at a later point, to understand from you, what are the entry points for MH projects from EU? What would you tell SuSanA partners? You can give a 30-second answer now, but otherwise, I don't know how you feel about it.
I mean, there are many entry points, and the EU is a huge bureaucracy, and there's a lot of different funding streams, obviously. As you know, we've tried to push the funding to the country context. So right. I would first ask you to work with your delegations in the countries where you are, because that is where most of the funding is. We also have civil society funding, of course, WASH and health streams. So it depends a little bit of the size of the partner, where you are situated, if you're working together with an EU member state organization, or if you're working on a local initiative in a particular, let's say you talked about Malawi. I would say it's less if you're an NGO working in Malawi only and you have better access to funding through there. But don't be shy. I mean, there is nothing that says you cannot procure menstrual cups and distribute them freely with funding both within the UN, from member states, and from the EU. We have for years distributed condoms, bicycles, school books, uniforms, you name it. And for some reason, I don't know, because for 20 years I'm trying to look at procurement figures. How many menstrual cups, how many menstrual products have been procured by UNFPA, by WHO, by different organizations? And I tell you, the figure is very little. And
okay, we'll take that up. We'll take that up. And if we are allowed to sort of to speak to you and maybe then give some guidance to the SuSanA partners interested, I think that would be wonderful. We have another celebrity coming and closing, because during COVID, I think, Gina, you were talking once a week in Cagayandoro and informing the latest updates. So as a member of our Global Steering Committee, Gina, if you can close in a minute or so this meeting, because we're shooting over time and usually people have other appointments. So Gina, closing is yours. Thanks for being with us. Your mic has to be opened.
Sorry. Okay.
Yes.
Good evening, good morning, good afternoon to everyone. When the talks were being given, I couldn't help but, of course, relate it to my experience as based in a low middle income country, and all of the issues that were taken are so familiar to me. From the infectious disease of Kartik was talking about, and the story of Jon Snow and cholera in London, and very interesting, his wastewater-based surveillance, which I don't fully understand yet, but I will study about this. And strengthening health systems of healthcare facilities with no water. Yes, that is familiar to us also. I work in a facility in a big level 3 hospital that sometimes has no water. So go figure. And of course, the issues on menstrual health and menstruation in women, no, still is a problem up to now. So, and then the WASH and health talk was very interesting, and again, we mostly could relate to that, and especially the fact that most WASH-related deaths are largely preventable. No, that is what breaks our heart. That is what breaks our heart in poorer countries, because the money, the very scarce money, goes to something else other than preventing deaths that would be cheaper. No, preventive medicine is cheaper than curative medicine, but our politicians would rather give money for building basketball courts than building water systems. This is so true. Whenever I have chances of talking to politicians, I tell them, please fund water systems. Aside, do not fund basketball courts. The Philippines is a basketball crazy country, you know, even if we are short people. So people insist on playing basketball even if we are short. Okay. So the paper is comprehensive and resonates with issues very familiar to us, and I think I have nothing else to add to that paper. It tells a beautiful story of what we should do and how to approach the problem of WASH and health. No, and I'm actually personally very glad that sanitation and water related diseases are back in health. No, I already said that let us not forget that all of this is still health related, because it's being related to many things. Sometimes I fear that people forget that it's a health issue. And so with that, I end. I hope it has been a good closing remarks, and thank you to everyone. Yeah.
Gina, I would suggest tell the politicians at least WASH facility at basketball courts. Maybe that's an entry point we can aim for in the Philippines. Thanks everybody for being with us. Thanks. Spread the word. Day after tomorrow is World Toilet Day. Spread the paper. Thanks for supporting the paper and this seminar, and have a wonderful day. And yeah, see you soon. Thank you so much.
Bye. Thank you.
Thanks, everyone.
Thank you.
Thank you. Bye-bye.
Thank you so much.
Bye.
Bye.
Thank you. Goodbye.